In this city, it doesn't take long to find addicts injecting drugs. There are thousands. Until recently, many did get medical attention and advice from charity workers who also handed out clean syringes to reduce the spread of disease. But then Punjab's health secretary suddenly asked the biggest charity to hand over the personal details of all the drug users it worked with.
We amicably wanted to explain that we can't do that, according to the contract and according to the International Code of Ethics. And he stopped our money and he cancelled the contract, and that's it.
In spite of appeals from the World Bank that funded it, the drug charity remains shut. All its staff, including doctors, sent home. Tahir used to be an addict before he says that charity saved his life. He used to steal to pay for the drugs he injected, but now he's an imam, telling others of the dangers of drugs and HIV. But he's furious the government has, as he sees it, unfairly closed the project.
Drug users here knew about HIV because of that project. The workers handed out clean needles. Now the addicts are sharing again. I blame the government for each one that dies.
The health secretary says he was annoyed the addicts' details weren't given to him, but now claims the project was ended because staff weren't being open about how they operated. Well, we've just been to see the health secretary and he says he can't appear on film, but he insisted that this was an issue of transparency. But the charity says the only information he asked for before terminating their contract was the names and addresses of the drug users. The health secretary didn't say why he wanted addicts' details, but said it was the government's right to have them and to stop the charity if it wanted. But all the addicts we found spoke of shocking consequences. When I inject now, this man says, there's a queue of people waiting behind me to use my syringe, and nobody comes to help with our wounds anymore. The government says it will deal with these problems. With the number of drug users here and the potential for the spread of disease, every day is crucial. Aleem Maqbool, BBC News, Lahore.